Christian Lindmeier is a spokesman for the World Health Organization. He joins me now from Geneva. Thank you very much for joining us here on TRT World.
Thanks for having me. Merhaba.
Merhaba. What more can you tell us about this drug and how does it work and what's the actual timeline?
So how the drug will work is not quite clear. It's they're testing it, they're working on it, and we'll hope that the tests are successful. Of course, any treatment is welcome right now if it's effective and useful, because at this point we have nothing. We have no direct treatment against the virus. We only have what's called the clinical treatment, meaning if you have a pneumonia, the pneumonia gets treated. If you have fever, the fever gets treated. So yes, this would be a welcomed stage forward. But again, let's not get overexcited. Once we have it, then we shall.
Of course, we are hoping to get more information as much as we can on it. But you said more things can be done. Well, blood infusion was being used. Is that still used as a treatment?
Again, so this is part of the treatment, the clinical treatment individually on different types of presentation of the symptoms you have. You may need a blood transfusion at some point. That could be a useful treatment at a specific moment. But let's not forget, this is really only for the severe cases. Most of it, more than 80% of people who get affected or infected by coronavirus will have mild symptoms, mild to the point that you may not even realize that you may have been infected, which is actually part of a problem, because people who don't know they have been infected will not be taking careful measures of not infecting others. So a mild symptom could be a very small elevated fever. It could be just a little bit of a headache and a slight cough. That's all that could be. But of course, if it develops stronger, you might have really difficulty breathing and higher temperatures and a strong cough. Then you know it's time to go to the doctor. And that's when people normally latest go to seek medical assistance. But before, when it's milder, that's when it's a bit more tricky to develop. So again, treatment for the individuals is important depending on the symptoms.
In that sense, when you mention that, because I know in the UK, basically, if you have any symptoms, they tell you to stay home. So unless you test it, you won't know. So the numbers could be even more than we actually know, isn't it, in this case?
Well, let's not forget, it's the winter season in the Northern Hemisphere, so people will have all types of symptoms of cold, of flu, of respiratory illnesses at this time of the year. And that's why it's recommended, actually, yes, to stay home for a few days, monitor yourself for a while to see if the symptoms get any stronger, any more specific. If yes, then please seek medical help. If it's just the typical self-regulating soft symptoms, then you might be best off stay at home, have someone take care of you with precautions, and just don't go out to infect possibly others. That might be the best way forward right now, because if we overburden the healthcare system with every mild case, we may not have space for the serious cases.
Yes, and as we mentioned from the start and been reporting on the coronavirus, we always mention that many of the deaths is actually people with underlying health conditions or in countries with less resources and equipped hospitals. So in that sense, when we look at it, should we be less worried than we are?
It's good to be concerned and to be cautious. That means, like you would do with the flu, if you know somebody around you has a flu, you would not get too close. And if you have to take care of that person, for example, or if you have to get close, protect yourself with proper hand hygiene, especially after you've been in touch with that person. The person who is infected, they should maybe wear a mask so not to spread actively the virus. And if you take care of those preventive measures, of these simple measures, you can do a lot. It's equally important that the daily life doesn't get too much disrupted, because when you go about your daily life, you have a certain routine that installs a certain quiet. If everybody now starts freaking and stay at home, this wouldn't serve the purpose either. So let's be cautious, let's be prudent about it, like you would be in a normal case.
As you said, we should carry on with our everyday lives, but looking at the precautions, especially Italy is putting 10 towns under lockdown and people get fined if they leave or exit, or in the UK, they send to parents, if your child is sick with any kind of fever, don't send them to school. So what do you make of these precautions? Do you think it's the right way to go?
No, that's actually exactly right what you're saying there. And it's good to take these preventive measures, but not everybody in a blanket measure. That's the point. So not whole Italy is on lockdown. Not all Britain is on lockdown. So if you have symptoms, if your child seems to have symptoms, yes, don't send them to school to prevent the risk of further spread. The towns in Italy which are on quarantine right now, that might be the right measure right now to prevent further spread. But again, this is a measure targeted on a specific situation at the specific moment. And that's exactly what authorities should be doing. As yourself, if you go to a place where there are people affected or infected and are coughing, you would protect yourself differently if you're walking alone in the woods. Very stupid example maybe, but again, your preventive measures, your actions have to be measured against the level of risk.
Well, we have to wrap it up here, but thank you very much for joining us here on TRT World, Christian Lindmeier.